Alarming projections from local health experts of a possible surge in COVID cases as we head toward the holidays. They say it emphasizes the need to strictly follow all the necessary precautions. Manolo Morales reports.
The president of Queens Medical Center and the president of HMSA told the Senate Special Committee on COVID-19 that we are basically heading into a perfect storm of conditions that could lead to a surge. It has little to do with the surge already happening on the mainland or travelers coming here. Queens showed a projection with a surge starting in October that leads to more than 400 COVID patients when the surge peaks in January.
Because people come in, they gather, they're going back to school, they're going back to work, and there's holidays. And those holidays foreshadow lots of gatherings.
She says if everyone wears a mask, follows physical distancing guidelines, washes their hands, and avoids gatherings, the surge can be avoided. And that's why a new mask mandate would be helpful.
We need a mask mandate that's very simple and straightforward that people all would be doing.
You just say, wear a mask in public, statewide, and here are the exceptions, and there are very few.
Maui Mayor Mike Victorino said Friday afternoon that an announcement could be made any day now of a new mask mandate.
So that's coming down. That'll make it easier from going from intra-county travel to Maine people coming in from Maine. It'll be one policy as far as wearing a face covering.
Haggard Green says the surge on the mainland is troubling, but the data shows that reopening tourism has not had a significant effect. Gatherings have been the problem. With a vaccine possibly being ready by the end of the year, there's also the concern that not enough people might want to take it.
Right now, I'm seeing numbers like 30% of people are saying they would be willing to go out and be in the first wave of people get vaccinated, and that's not enough to get herd immunity.
Senators also raised concerns with being able to store the vaccine. The one made by Pfizer will have to be stored in extremely cold temperature and requires 2 doses given 3 weeks apart.
I don't think that'll be a struggle for, big pharmacy chains and things like that to store it. So I think we can be prepared for that type of, storage logistics.
Manolo Morales, KHON2 News, working for Hawaii.